The 4-hour window. It starts with a dropped coffee cup. A woman reaches for her mug one ordinary morning, and her hand simply doesn't obey. It slips from her fingers before she's even registered that something is wrong. Her husband laughs it off. She's probably just tired, maybe slept on her arm wrong. He tells her to sit down for a minute. That one decision, to wait and see, is about to become the most important decision of her life. Dr. Rebina Anor has watched this exact scene play out more times than she can count. She's a neurologist with Baptist Health Brain and Spine Care, and she knows the brutal math nobody standing in that kitchen does. From this moment, there are exactly 4.5 hours before one of the only treatments that could reverse everything becomes off the table forever. The 90 seconds that decide everything. Dr. Anor didn't need years of training to learn the acronym that matters most in her field, but she needed those years to understand just how much weight it carries. FAST. F is for face, a sudden droop on one side, usually in the lower half. A is for arm, a sudden weakness, often on the same side as a leg that's quietly failing too. S is for speech, words that suddenly slur, or make no sense, or won't come out at all. And T is for time, because every second spent waiting is a second the brain doesn't get back. What she's noticed, again and again, is that the hardest part is rarely the medicine. It's the moment right before anyone decides to call for help. Families second-guess themselves constantly. Was that droop always there? Is she just exhausted? Did he just mumble because he was half asleep? Dr. Anor has learned not to blame them for the hesitation. She's just spent years trying to shrink the window where that hesitation can do damage. Because here's the part most people never learn until it's too late. FAST isn't just a checklist. It's a countdown that started the moment symptoms began, whether anyone in the room realized it or not. The clock no one can see. This, she's found, is the single most misunderstood fact about stroke care. There are 2 major interventions that can undo the damage of a stroke: a powerful clot-dissolving medication and a surgical procedure called a thrombectomy that physically removes the blockage. But both come with a hard deadline attached. The medication works only within 4.5 hours of a patient's last known well time. Not from when someone noticed something was wrong, but from the last moment they were truly fine. The thrombectomy has a longer runway, up to 24 hours, but it's not guaranteed either. It depends entirely on where the clot is and how the patient's brain has held up in the meantime. Miss both windows, and the options for reversing a stroke essentially disappear, leaving only the slower, harder work of managing whatever damage has already been done. That's why Dr. Anor tells every family the same uncomfortable truth. The ambulance ride isn't the beginning of treatment. It's already the middle of the race. Every detail gathered along the way, medications, medical history, and above all, the exact last known well time, becomes ammunition for the team waiting at the hospital. But recognizing the symptoms is only half the battle. The other half is knowing which stories about stroke are actually true, because she's seen firsthand how the myths can be just as dangerous as the disease itself, the myth that costs the most time. Ask most people who get strokes, and they'll say, old people. Dr. Anor wishes that were still fully true. It isn't. In her clinic, she's treated a growing number of younger patients, some in their 30s, arriving with the same blockages doctors once expected only in patients decades older. Autoimmune conditions that quietly inflame blood vessels, cannabis use, alcohol. She's watched these factors stack the odds against people who never thought they'd need to know what FAST stood for, simply because stroke wasn't a word attached to anyone their age. And that's not even the strangest thing she's learned: the stroke. You don't feel. Most people assume a stroke announces itself with pain. Dr. Anor has treated patients who felt nothing at all, some who didn't even realize, in the moment, that anything serious was happening to them. A stroke, she explains, is far more often a story of things disappearing, movement, speech, sensation, than a story of pain arriving. She's also treated plenty of patients who did everything right. Healthy diet, regular exercise, no family history anyone knew of, and a stroke hit anyway, often traced back to a genetic clotting tendency, more common in women, presenting with symptoms that don't match the textbook at all. If there's one myth she's most determined to kill, though, it's the idea that once a stroke happens, recovery is off the table. But before that story plays out, there's another one worth telling. Because not every case ends with an ambulance, the one who almost got away. Not every warning sign is as loud as a dropped coffee cup. Sometimes it's quieter and far easier to dismiss. Dr. Anor has treated patients whose arm went numb for 10 minutes on an ordinary Tuesday, then felt completely normal again by the time lunch rolled around. Speech that slurred for a moment during a phone call, then cleared up before the call even ended. Most people, understandably, breathe a sigh of relief and move on with their day. Some of her patients did exactly that and came back days later with the real thing, but some didn't wait. They called their doctor or came into urgent care, describing symptoms that had already resolved by the time they walked through the door. And that decision, to get checked out even when nothing looked wrong anymore, is often the one that changes everything. The warning sign. Almost everyone ignores. What those patients experienced has a name, a transient ischemic attack, or TIA. It looks like a stroke, behaves like a stroke, and then reverses itself within 24 hours. But Dr. Anor has learned the hard way that a resolved TIA isn't a relief. It's a warning shot, a sign that a full, permanent stroke could follow within days, sometimes even hours. She treats a TIA with the same urgency as the real thing, a full diagnostic workup, imaging, and often an aspirin regimen started immediately because the underlying clot risk that caused it hasn't gone anywhere just because the symptoms did. Waiting to see if it happens again is exactly how families end up back in the emergency room, except the second time, there may be no window left to act at all, rewriting the odds before it ever happens. None of this means people are powerless, and this is the part of her job Dr. Anor wishes got as much attention as the emergency room does. Quite the opposite. She's watched, patient after patient, how a handful of unglamorous choices can rewrite the whole story before it ever starts. Take cholesterol, blood pressure, and diabetes. 3 things that quietly damage blood vessels for years without a single symptom to announce it until the day they finally do. Smoking works the same way, stacking risk with every cigarette in silence. On the other side of the ledger, a Mediterranean-style diet, light on salt and saturated fat, heavy on vegetables and healthy fats, paired with about 150 minutes of movement a week, split into pieces small enough that people actually keep doing it, rather than one brutal workout nobody repeats. None of it makes for a dramatic thumbnail. But Dr. Anor has watched patients who spent a decade ignoring their numbers, and patients who spent a decade managing them. And by the time either group reaches their 60s, the difference between them is never subtle. It's the difference between a life that keeps going on schedule and one interrupted by exactly the kind of morning that started this story. Back to the woman with the coffee cup. So what happened to her? The one who dropped her mug that morning. In the version of this story Dr. Anor has lived through more times than she'd like, everything hinges on what happens in the next few minutes. If someone in that kitchen recognizes the droop, the weakness, the strange thread of words, and calls emergency services immediately instead of waiting to see, she reaches the hospital inside that 4.5-hour window. She gets the clot-dissolving medication, maybe the thrombectomy too, if the blockage calls for it. And then the real work begins. Work that Dr. Anor insists is never done alone. The team no one sees on camera. A stroke patient's recovery runs through an entire team. Emergency responders, neurologists, neurosurgeons, and rehabilitation specialists, all coordinating around a single goal. What she's come to believe, watching this play out for years, is that this coordination, quiet, unglamorous, happening in hallways and handoff meetings, is often what actually determines how far a patient's recovery goes. Some patients move to a dedicated rehab hospital, working daily with physical therapists rebuilding movement, speech therapists rebuilding language, and occupational therapists rebuilding the small, ordinary tasks of a normal day. Others recover at home, with therapists coming to them. Some transition through a skilled nursing facility first. Overseeing much of it, she's found, is a rehabilitation physician whose entire job is guiding that process and helping the wider team chart the best path forward for each individual patient. It rarely happens overnight. Most patients, she's observed, reach their peak recovery around the 9-month mark. But she has watched people walk, speak, and return to their lives after starting from a hospital bed where none of that seemed possible. The alternative, the version where the family waits, where the ambulance call comes an hour too late, is the version Dr. Anor has also witnessed far too often. It's the version she spent her career trying to prevent, one fast acronym at a time, the machines racing to catch up. What keeps Dr. Anor optimistic is what's coming next. Researchers are actively working to extend those brutal treatment windows, testing whether it's safe to help patients who arrive just outside the current 4.5-hour and 24-hour limits. Patients who, right now, simply run out the clock through no fault of their own. One of the newer tools already making a difference is a recently approved device that stimulates the muscles involved in swallowing, helping stroke survivors recover that ability faster. It sounds like a small problem compared to everything else a stroke can take away. But Dr. Anor knows firsthand it's anything but minor. Patients who can't swallow safely risk inhaling their own secretions, which can trigger pneumonia and turn a hospital stay into weeks instead of days, piling complications on top of an already difficult recovery. The hospital that comes to you. But the development she's most excited about is Telestroke technology, the ability to connect a patient in a remote area to a specialist neurologist in minutes rather than hours, closing a gap that has historically left rural patients without timely access to the exact kind of expertise that makes the biggest difference in that first critical window. She envisions a future where that same idea extends even further into telesurgery, where robotic advances might let a patient receive treatment without ever needing to be physically transferred to another hospital at all. The 4.5-hour window isn't going away anytime soon. But if there's one thing years on the front lines have taught her, it's that the gap between a devastating outcome and a full recovery has never really been about medical miracles. It's been about someone in the room recognizing the signs fast enough to make the call, and about a system built by people like her, ready to move the second that call comes in. That's the whole story, really. Not a mystery, not a twist, just a countdown that starts the moment nobody's watching for it, and a chance to change the ending if you know what to look for. If this video helped you understand what those first few minutes really mean, hit that like button and subscribe for more real conversations with doctors who see this every single day. Drop a comment below. Has stroke ever touched your family? Or is there a health question you want us to put in front of a doctor next? And turn on notifications, because you don't want to miss the episode that could matter most. Stay healthy, and we'll see you in the next one.